We'll get started. Okay, well, welcome everyone to this introductory call regarding GUIDE, which is a new Medicare program paid for by CMS. So I'm really excited to introduce this to you all and tell you a little bit more about the program. My name is Debbie Miller. I'm owner of Senior Helpers, and gosh, I have been in the senior care business now. I'm in my 19th year. And so I'm very happy to represent my care team. Some of them may have invited you to today's session. So on behalf of my team, welcome. And I'm definitely looking forward to sharing this great information with you. We have some healthcare partners on with us today. We even had a couple politicians who registered, and we have family members as well. Everybody knows somebody who is caring for somebody with dementia. And so I want to arm you with some information to share with them about the program. So we're going to look at what GUIDE is and why it exists, why this matters now, who qualifies and who doesn't for the program, and then introduce you to a really simple referral process where you can make recommendations for folks that you may know. If you are a referral partner, we're going to make it as easy as possible for you to share this information and get as many people as we can enrolled in the program. So let's talk about what GUIDE is first of all. It stands for Guiding an Improved Dementia Experience. And as I said, this is funded by CMS and first ever of its kind. And so basically what it is right now, as it exists, is a model to test the impact of providing comprehensive services and support to people with dementia and their caregivers. So that's what's really unique about this program. It's really to support the family caregiver. The model began in July 1st, 2024, and it's going to run for 8 years. So this July, we're actually coming into the third year of the program, and we have been involved in the program pretty much from the very beginning. And the program provides coordinated care, caregiver support, and best of all, funded respite care services. So that's where senior helpers can really come in and support the family caregiver. So I'm going to tell you a lot more about the program. But when we think about why now, certainly when we look at the national landscape, we're seeing a rise in dementia. And that puts a lot of pressure on family caregivers, right? Most care is being provided by loved ones. And so the need for care is increasing really rapidly. And so CMS really wanted to address this. And when I said earlier that this was a program really designed to support family caregivers, this is one of the things I absolutely love about this program. And this is the number one reason it exists. The reality is 35 million people are caring for somebody with dementia. There are somewhere between 45 and 50 million family caregivers now in America, but 35 million of them are really dedicated to caring for their loved ones who have dementia. And so what they experience is they really experience a fragmented ecosystem, right? Where they don't get a lot of support. It's really difficult to even get appointments with, say, neurologists to get the diagnosis. We'll talk a little bit more about that. But there are just the burden of care in America, and having done this business for as long as I have, I've never seen so many family members being put under a tremendous amount of pressure to care for their loved ones. And so CMS is really trying to tackle that with the program. In fact, caregiver strain is one of the biggest drivers of emergency visits, hospitalizations, and premature placement. A lot of times families are just overwhelmed and they end up institutionalizing their loved one. And so GUIDE is focusing on supporting these family caregivers so that these people that have dementia can remain in their home longer and safer with the supports they need. Because if these family caregivers aren't able to do what they do best, the whole house of cards comes crashing down, right? And we just do not have the healthcare system, nor can our government afford to pay for all of these folks that do have dementia. So help is here, and this is one of the amazing things about the GUIDE program. When we look at the burden of care in America, and for those of you who know my care team, you know that we really have a heart for family caregivers, and we do a lot of dementia training throughout the community to help them better understand the disease and give them care techniques to help them make this a little bit easier. So to give them strategies that can help deal with behaviors and just better understanding what their loved one is going through and how to react to certain things. The average family caregiver will provide 22 hours of care a week to their loved one, and 25% of family caregivers are providing 44 hours of care to their loved one. And when you think about why this is such a stressful situation, there are a lot of people still working and still working a full-time job. As an employer, as a large employer in the Nashville area, there's not a week goes by where one of our employees needs to take time off or take their mom to the doctor or this kind of thing. So we see it firsthand, as well as with our own families that we are supporting. So there is a high level of stress. It's both emotional, physical, and financial. 66% of caregivers use their own retirement or savings funds to pay for the support that their family members need. So that is putting a lot of stress on these families. And so this is where the GUIDE program, again, can really support them. Now, when we look at the number of people and the number of families that are involved in providing care, so a lot of times people wonder, well, why aren't more seniors and families getting support, getting the help that they need? And there are some reasons for that. One, sometimes just the person with dementia is living in denial, maybe even the family, and they think mom's going to get a little bit better. And of course, we know that this is a progressive disease. And unfortunately, they continue to decline in their ability to perform their activities of daily living. And ultimately, it's going to affect their ability to live independently. Yet they desire to stay at home, right? So there's this little bit of a struggle with the family who maybe identify mom needs help, but the person themselves isn't willing to get some help. And that can be a challenge. Also, there's this sense of responsibility to care for their loved one. In 83% of that long-term care that's being provided is by family caregivers. A lot of times they don't know what's available to help them. They don't know where to start. They don't know where their options or what their options are for support. And so that's where, our referral partners really come in, that they, a lot of times they can really throw a lifeline to these family caregivers that are really underwater. And then finally, this is probably the number one issue that most people face, and that is the cost of care. And I know that it can be expensive. As a provider myself, the cost of our care is getting more and more expensive, just as everyone is experiencing inflation in other aspects of our life, right? Of course, it's happening here also in senior care. So I am so excited to report that the GUIDE program is a completely free program. All right. And so here are the components that are included in this program. So it includes a comprehensive assessment by a care navigator. So everyone that is enrolled in the program, the family caregivers, will actually be assigned a care navigator that you will have to walk out this journey so that you're no longer doing it yourself. That in itself is just an incredible support. They also provide caregiver education, a 24/7 hotline, so that you have somebody at the end of your phone who can help you day or night, whatever you're experiencing. You'll have a clinician available to you at all times. And then there is access to respite care. And that is, this actually just increased, that we just got the announcement that is going to increase to just over $2,600 a year in respite care. I'm going to tell you more about that in a minute. And so that is one of the components, and that's where, as a home care provider, we're able to provide the care free of charge to the person, to the enrollee. So then when I say free, there is not even a copay. All right. Unlike other Medicare programs that do require a copay, that's not the case here. Anybody that's enrolled is able to keep their primary care doctor, although you'll have a whole clinical team available to you through the program. And you're going to have a dedicated care navigator. But all of this is free of charge. So let's talk about who qualifies. All right. So this is a CMS, a traditional Medicare program. All right. So a person does need to have traditional Medicare, not an Advantage plan. It's a traditional Medicare. They also need to have a dementia diagnosis or a suspected diagnosis. So there are a lot of people that actually, their families know they have dementia, but they just have never gotten the diagnosis. Well, we'll talk about how we can help remedy that. They also need to be living in the community. So in a home, in an apartment, they can even be living in an independent or retirement community. And they need to have either an advocate or an unpaid family caregiver involved, because there is a certain amount of process that we need to work through, and somebody with dementia is going to struggle with that if they're on their own. So, so we've got, for those of you who are care partners on the call today, imagine how many clients or patients you already have that meet this qualifications. So we're here to help them get started. For those of you who are family members on the call today, and you have traditional Medicare and you're caring for somebody with dementia, we're going to be able to help you get enrolled in the program. All right, so here are the folks who will not qualify. All right, so this is the folks that are not eligible for the GUIDE program. And these are people enrolled in certain special needs programs, hospice or PACE. If they're already taking advantage of those programs, that would disqualify them for enrolling in the GUIDE program. Also, as I said, if they have Medicare Advantage plans, and if they live in long-term care. So that, like a nursing home, or if they're living in an assisted living facility or a memory care center. That was one of the changes that just happened and goes into effect this July. So the 2 years prior, they could live in ALF or memory care, and they have removed that from the eligibility criteria, unfortunately. So now, those on Advantage plans, we can still help them tap into other payer sources that they may not be aware of that they're eligible for, like veterans benefits or Medicaid choices, or if they have a long-term care insurance policy. We can help them through that and help them get the care that they need and get the support for family caregivers. It just won't be through the GUIDE program. All right, so to give you a little bit of background on how this all works, there are two sort of entities involved in making all of this happen. There is first the home care agency, like Senior Helpers, and then there is a credentialed Medicare partner that is approved as a GUIDE provider, okay? So because home care does not bill Medicare directly, that's not how we are set up, and we don't have that infrastructure. We have to be working with a credentialed GUIDE provider who actually administers the whole program, and think about it as a case management or a care management model that CMS runs, and they've been approved by CMS. They do all the billing and so on. We just deliver the respite care piece. All right. So we've got very clear lanes that we stay in, but it does take two to tango. So it takes us as the home care provider, and we have a partnership with the credentialed GUIDE provider. Now, these GUIDE providers also need a home care partner. And the reason for that is a lot of these credential partners are national organizations that operate virtually. So the case management is actually done virtually. So a lot of the appointments with the clinical team is done via Zoom, much like we're doing this today, and or telephone calls. So they really need that local partner to be able to provide the respite component of the guide program. So I'm going to tell you a little bit more about our provider that and partner that we have, but Guide cannot succeed without a home care partner. And of course, because the families really want that hands-on support with the respite care. So we kind of work in tandem through the program. Now, as I said, we have been doing this almost since the program started. We started it in September. And we've learned that not all guide providers are created equal. And so I want to share with you quick history on where we came from and where we are now, and how much more simplified the program has become in terms of enrolling families and enrolling your patients or residents in the program. So we started with a provider. My Senior Helpers corporate team created an agreement with the program, and it was a little early. They didn't have the infrastructure necessary to really manage the volume of referrals that we were providing to them. So right out of the gate, we had 40 to 50 guide referrals that we were putting in the system, and they just couldn't handle the volume. So I actually met with another provider, and they're called Harmonic Health. I'm going to tell you a little bit more about them in just a second. But I actually partnered with the owner of that program, or of that company, and my care team, who are phenomenal. We worked with them for 9 months to fine tune this process, and they created a portal that we were able to weigh in and help them to really to simplify it for enrolling patients and for monitoring where patients are in the process. What happened is we would make referrals and we never knew where they were in this whole process of qualifying. Now, when we make a referral, we can actually have transparency into exactly where they are along the workflow to get them to the point where they are actually receiving the respite care. So we've actually enrolled now 300 patients to the guide program. And it's been just an incredible experience for our families, and of course, giving them the support that they need and connecting them with this clinical team who can help them with all of these other needs that they have in terms of, getting even as far as getting a diagnosis. So we've got examples of folks who've waited literally that are on have an appointment for a neurologist for 2028. That's been really challenging. So it's hard to get a diagnosis if you're waiting that long. So they have a clinical team that can actually help with diagnoses and really getting to all the medical records and things like that. So think about it as Senior Helpers has this dementia clinical partner that works behind the scenes to support these families. And so we're able to get them enrolled quickly and follow them, intervene if we need to correct any of the bottlenecks that might be happening and help them get back on track so that they can get approved for respite care and we can start that. So let me tell you why Guide matters now and why it's really important that we get this education out there. CMS, they see this as a model. It's 8 years, right? And at any time, they can actually make this a benefit. If they make this a benefit, then the Advantage plans have to follow suit. So we want to get as many people enrolled in the program, and so that they can measure the outcomes of the program, and then hopefully there's going to be some long-term changes where this is going to be provided to more and more people. So right now we've got millions of patients who received a letter from CMS, and they've been pulsing them out And so these letters have been sent to anybody with a diagnosis, and we know of, thousands of them going out in Middle Tennessee area. And so there are a lot of folks that have questions about the program. They really don't know, well, what is it? What do I need to do? Sometimes they're thinking that it's not real. They're going to their doctors or other healthcare professionals, and they're not aware of the program. So we're trying our best to really get this information out there. And so this is why this is really important now. So what we're seeing is there's this current need that needs to be met. So we've got basically 6 to 7 million diagnosed dementia patients right now across the country. That in our area alone in Middle Tennessee, it's almost 90,000, 90,000 diagnosed patients who will be receiving these letters. Now, hopefully their family caregiver is going to intercede and find that letter and hopefully get some more information about it. But we want to arm our healthcare professionals and family members who can spread the word about the program. So we've got this 6 to 7 million across the country right now. That is the current need that we want to get enrolled into the GUIDE program. But right behind that are millions and millions of people who actually have not got the diagnosis and or who have a diagnosis of mild cognitive impairment. Those are going to be the future recipients of the GUIDE program. So there is a big opportunity here, and there is a potential here for $100 billion in long-term care and support funding through this program. So very, very significant. So I want to point out that right now, as you are all listening to this, we have thousands of patients in our community who are eligible for GUIDE benefits now. So if you can tell, I'm pretty excited about it, and I hope that you will help us get this information out. Now, if you're hearing this and you work within an organization and you would like to have this presentation provided to your teams, please reach out to the number. I'm going to give it to you at the end here, and we'd be happy to present this to your team. So Senior Helpers is the first certified GUIDE-ready respite provider in our area. And this was very intentional. We went into this and we've been doing this for a couple of years now and have grown a long way. But what this means is we have a completed specialized training in this area of dementia. We are willing and able to support dementia caregivers through our collaboration with our partner and through our own educational efforts that many of you are aware of that we do on a regular basis. We had to be willing to provide non-medical respite care and do it quickly because there are folks when they need it, when they're ready to go, we've got to be ready to go. We also committed to educating the community about the GUIDE program, which is what today is all about. And then that we are committed to following the referral workflows with our partner, Harmonic Health. And we have the capacity to start at least 10 new GUIDE patients per month. And we're actually seeing that almost on a weekly basis. So, and that's no problem. So I want to show you kind of how we're partner for success and how this all works. So Harmonic Health is our national partner. And when I say national, they serve the whole country. And they are our credentialed GUIDE provider, but they are also a dementia clinic. Think about it that way. And so they administer the program. So they're responsible for the assessment, building the care plan, providing the caregiver training and education, or linking them to what we've got going on in our area where we are concerned. They provide the navigator, coordinate other services that are available in our community. They offer the 24/7 hotline, and then they authorize the respite care. So what they do is once that person is authorized, they send that authorization to us, and we're able to begin the respite care. So we will work with the family, create the schedule that makes the most sense to them, and I'll show you how that can be spread out. So it's truly a partnership with purpose. We've got the dementia trained home provider. We are connected to the GUIDE provider and virtual clinic. And we have been now an easy onboarding. This is a very powerful software platform that supports families. We actually can enroll them really quickly and then monitor their progress, as I said. We also have created many educational materials to help our healthcare providers and partners across our community to get this information out. So we've got many different types of flyers and handouts and things like that that you can make available, posters that to help them understand that this program is available. And we're doing many, many community educational seminars to help educate family caregivers. So where we've gotten to the process now, we can enroll a patient and in many cases start respite care if we get all the information correct between 2 to 4 weeks. We can begin that respite care for that particular family. So here's how the respite care is used, and it can vary. All right. So the amount of money that is allotted works out to close to 80 hours of respite care. And that is per year, which doesn't sound like a whole lot, but look at the different ways that this can be utilized. And by the way, that refreshes every July. So we have folks right now that are just finishing up with their respite care, and it begins all over again July 1st. So, and it's pretty much an automatic thing. It's really really nice the way they've set it up. So every July it renews. And so here we have to deliver the care in 4-hour increments, which is the way CMS set it up, so that we don't have a lot of flexibility under 4 hours. But a person could really stretch this out and use 20 hours a month for 4 months, or 4 hours a week for 20 weeks, 10 hours a week for 8 weeks, or 8 hours a day for 10 days. So think about somebody that's transitioning, say, from rehab, and what a great program. We can get the respite care going potentially before they even discharge, and they could receive 8 hours a day for 10 days. So that would be a really nice transitional support that they would receive when they discharge. So for families that are on the phone, you are obviously going to get a layer of support, plus this respite care that you may or may not have had. And what we're finding is a lot of folks that will start with the guide program and maybe didn't realize. So it's giving us exposure to people that we may or may not have met prior to the program, but it gives us an opportunity to really examine any other payer sources that they may be eligible for. So about 30% of the folks that we are starting in the guide program actually are eligible for other payer options. And so we can help them with the veterans, community care, maybe it's aid in attendance, it might be the Choices program. We've had several who have long-term care insurance and didn't realize that they were at a point where they could actually activate their policy and have that pay for care. So, so it's really a great opportunity for folks to kind of dip their toe into this whole home care realm and get a feel for what it's like to get some support at home. For you referral partners, you can obviously use it to support caregivers that you interact with, and then also provide that respite relief, especially if it's not something that they could normally pay for. For discharging patients, we could start home care for the first 10 days post-discharge, and obviously the goal there is to help reduce readmissions. For anybody living in assisted living or memory care and maybe they're waiting and they're on a waiting list, we could provide some support to the family while they're waiting for that move-in date. For folks in home health, this is an amazing support program to work alongside what you are doing. And obviously we can help reduce hospitalization, improve outcomes, and alleviate some of the burden that those family caregivers are carrying. For physicians, we want to help you combat caregiver burnout. You've got a lot of folks bringing in their family members who are stressed out themselves. So you can, they don't have to change their primary care doctor, but you can offer this layer of support. And they're going to appreciate you so much for that. Anybody living in independent living, we can absolutely provide, we can enroll them if they're living in their own apartment in any kind of independent living or retirement home. So that will help them potentially to stay in age in place, which most people want to do, right? All right, so I want to talk about, because there's a lot of confusion out there, and I want to try to help you understand how referrals work. Okay, so as a home care provider or as a patient that may be receiving the letter from CMS, CMS provides a list of these guide providers, and typically are national providers, and they could call them and kind of get enrolled themselves, but it can be a little bit confusing. But as a provider, let's call this a patient direct path. So they receive the guide letter, they're enrolled in the program by a guide provider, and then when they qualify for the respite care, then these providers will reach out to a home care provider like me, and we have agreements with several providers, and then they send me the authorization, and that's at that point where we meet the family and we coordinate the respite care. So that's patient direct path. The other path is what we're doing through community outreach. So we're helping to educate providers, family members, and help direct and simplify the enrollment process through our centralized phone number. And we can help the families through the process and enroll them ourselves into the platform and then be able to monitor them. So we get to meet the family, better understand what their needs are, enroll them, and then once they're approved for respite care, we will already have that familiarity with the family and be able to coordinate those respite care hours. This is what's nice about this is where we can explore other payer options and work with you healthcare partners out there to maximize their benefits to best support their needs, whether it's transitioning out and being discharged or home health or whatever it may be. So we really can help them better utilize the respite care, but also make it a really seamless process. So I just wanted you to understand that we're getting respite care going through other guide providers, but we're also doing our best to educate the community. And our partner, Harmonic Health, is very, very welcoming of us generating those referrals so that we can better understand what those folks' needs are and we can spend more time with them. So for our referral partners, or maybe you are family members who have received the CMS letter, that is the CMS letter. One of our clients forwarded that to us. You can let them know that we can enroll them here locally. And it really is a benefit for you to guide this process, right? So that they feel like they've got a little more local support. And so we know that the awareness is growing and there are going to be more and more of these letters going out. So we want to get this, as many folks as possible educated and aware that this is actually happening. And the patients do need direction and help in enrolling. So we are really doing the best that we can. So sometimes they need your permission that, yes, this really is a program. And yes, you really should pursue it because it will help you. So the family member knows that, you're behind this as a trusted partner for them. So, and then what's nice about our enrollment process is we'll know right away whether they've got the right Medicare, et cetera, and let them know. So we can kind of streamline that process for you. So your referral really does matter in this process. So here we are for you. We wanted to, again, really make the referral process as simple as possible. So we've created a centralized intake. That's our phone number, 615-591-7007. We can pre-qualify those patients on the phone, enroll them in the program, track their progress, and then once they are they're qualified, we'll be able to start the respite care. And as I said, help them just navigate this whole journey. As you know, we've been doing this for as long as we have. My care managers are social workers, so they're very accustomed to helping families. And over the years, we've helped lots and lots of thousands of families, and we've just kind of created that clearer path for them, because this can be pretty confusing to navigate. So here we are. For those of you family members that would like to enroll, you can call that number and we'd be happy to do that. For those of you who are healthcare providers and you have a base of patients or clients or residents who would benefit from this, we would be happy to meet with you, or to you could just send those folks over and we will reach out to them and get them enrolled. So, all right, wow. That was a lot of information to get through. So I'm going to open it up to questions. And by the way, in case you got on a little bit later, I have recorded this and I will be sending it out to participants so that you can share this out to your constituents and help us raise awareness about the GUIDE program. So let's open it up to questions. And you can unmute yourself if anybody has questions.
Debbie, this is Jonathan Morford. Thank you for the presentation, very informative. Can you spend a moment on what are the kinds of services provided by your respite care team?
Absolutely. So it is helping with activities of daily living. It can be engaging, companionship, typically whatever the family would be doing for that person. It includes, if they wanted to go for a walk, helping with all of their ADLs, whether it's the personal care, meal preparation, errands, going to the senior center, getting them out and about. So there's a lot there that we can assist with. Pretty much anything that would be typically included in home care is covered under respite care.
Gotcha. And then on the care coordination front, from Harmonic or otherwise, how do they coordinate with, a patient's primary care? If a patient already has primary care doctor, has a neurologist, they have that team there, how do they interface with the care team?
They'll actually reach out to the medical team if they need to. There will probably be a request for medical records, and so they do a direct communication with the doctor, the primary care doctor, or the neurologist.
Gotcha.
And their clinical team does all of that. We're not involved in that at all.
Gotcha.
Yeah, they're a full team of they have a doctor, nurse practitioners, mostly nurse practitioners that are engaging with the doctors.
Got it.
Yeah, great questions. Any other questions?
Hi, Debbie. Michelle Hay. I'm a care coordinator with Choices.
Hi.
Hey, and so your list of those items that would preclude someone from being involved included the SNPs and PACE, which by default are similar to Choices. So if I have a client who has traditional Medicare, no SNP, no managed Medicare, but they're on Choices, do they qualify for the GUIDE program?
Yes, they have traditional Medicare and Medicaid. Yes, they do qualify.
Great. Thank you.
It's amazing.
That was a concern that we had, and one of the reasons that I'm attending to find out. Thank you so much.
You're welcome. Any other questions? Well, thank you all so much for attending, and I would definitely appreciate you sharing the information to as many people as possible. If you do have any questions, or you would like me to do a presentation, please again just use that same phone number, 615-591-7007. Michelle, for example, if you'd like me to present to the coordinators, I'd be happy to do that. Just reach out to me. We can get something on the schedule for you.
I'll pass that along to my supervisor and manager. Thank you so much.
You're welcome. Well, that's it for now, everybody. Thank you again, and bye for now.